Well, according to the Atlanta-based CDC, 1 in every 7 women can develop a serious mental illness like postpartum depression after giving birth.
But doctors say there is hope. Abby Caceres explains how you can now find the first ever postpartum depression drug in pharmacies here in Metro Atlanta. Abby?
Well, the first step is to head to your doctor's office like the one here in downtown Atlanta because you'll need a prescription. Now, doctors say that they notice a change in their patients in just a few days. The pill is called Zurzuvae. You take it twice a day for 2 weeks.
Just like the most out-of-body experience, being like, okay, I've thought about this day for so long and now she's here.
Shannon Stevenson is one of 120,000 mothers who give birth in Georgia every year. She says as a labor and delivery nurse, she felt she knew what to expect when she gave birth to her daughter, Reese.
I just kept thinking, I'm terrible at this. The headlines on the news of, worst case scenarios, people with postpartum psychosis or whatever it may be, and you have this fear of what if that could be me?
An estimated 85% of women go through mood changes after birth, but 10 to 15% develop something more severe. The Policy Center for Maternal Mental Health gave Georgia an F for a lack of mental health support for new and expectant mothers. The group found that Georgia does not have enough providers and help for mothers struggling to pay for screenings.
This drug is a game changer. Any type of medication we can actually use to assist patients to getting back to their normal life and bonding with their child is absolutely vital.
Dr. Cecil Bennett with Noonan Family Medicine says gaining access to this life-saving care is critical during the winter months. With shorter and darker days, moms caring for newborns feel isolated. It may be difficult to manage postpartum symptoms.
Remember, this disease doesn't only affect the mother, it affects the child, and there can be short-term as well as long-term impact on the infant.
And there has been some criticism over the price. Those pills run people over $15,000 to pay out of pocket. It's pretty hard to afford something like that. But to put that into perspective, previous options were upwards of $30,000. There is some hope that insurance companies may cover the pill in the future. Live tonight in downtown Atlanta, I'm Abby Caceres for Atlanta News First.